This is a CJason podcast, and I'm Josh Bundy, an epidemiologist affiliated with Tulane University and Northwestern University. On behalf of my co-authors, it is my pleasure to discuss our findings on the Serum Calcification Propensity test and clinical events in patients with chronic kidney disease. We know from decades of prior research that cardiovascular disease is the leading cause of death in patients with kidney disease. One pathway by which cardiovascular risk is increased involves vascular calcification. If we could identify patients who are prone to vascular calcification, it's possible we could prevent cardiovascular complications in this high-risk patient population. A blood test was developed in 2012 to evaluate this question. The test is called the Serum Calcification Propensity test, or T50 for short. Basically, the T50 test measures the transformation time from one type of amorphous calciprotin particle, called a primary calciprotin particle, to another form called a secondary calciprotin particle. T50 is the mid-time point in this transformation and acts as a readout of the balance between calcification promoters and inhibitors in a patient's serum. The lower the T50, the higher the calcification propensity. Using stored blood samples, we measured T50 among more than 3,000 participants with chronic kidney disease stages 2 through 4 from the CRIC study. Then, we followed them over time and collected data on whether or not they had cardiovascular disease events, or end-stage kidney disease, or if they died. We found that a lower T50 time, which again means higher calcification propensity, was associated with a higher risk of cardiovascular disease events, which includes myocardial infarction, stroke, and peripheral artery disease. However, when we also adjusted for baseline kidney function, the association was no longer present. We observed similar results for end-stage kidney disease and death events. We interpret our findings as follows. Reduced kidney function may lead to a lower T50 time, or vice versa, and this close relationship between T50 and kidney function could explain why the associations disappear after accounting for kidney function. We believe future studies should evaluate T50 in other patient populations and investigate therapeutic interventions to improve calcification promoter-inhibitor homeostasis, all in an effort to address the leading causes of complications in patients with chronic kidney disease.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast of the American Society of Nephrology.